Assalamualaikum warahmatullahi wabarakatuh, and hello everybody. You can call me Sarah. I am delighted to be here today to talk to you about eczema. Do you know what is eczema? Eczema is a group of conditions that are characterized by red, itchy, swelling, inflamed patches, and cracked skin. It is the most common atopic dermatitis that is also known as atopic eczema. The presentation of eczema can be varied, so these are variations for how eczema may present. It might seem painful because of the redness of the skin, but eczema is generally not painful. Itching may be intense, and excessive scratching can damage the skin, causing sores that may be painful. However, you need to seek medical care if an area of eczema becomes painful. Plus, not to be worried because it is a common skin condition that is not contagious. Next, who can get eczema? Eczema usually starts in early childhood and may last into adult life. Generally, it is most commonly seen in babies and young children, appearing on infants' faces. It can also develop in both teenagers and adults. However, eczema can come in various types depending on the patient's age. The patches may appear on the face, scalp, neck, inside the elbows, behind the knees, on the buttocks, hands, and feet. Furthermore, eczema affects females and males equally and usually affect people who have personal or family history of asthma, food, or environmental allergies. What are the symptoms of eczema and how do you know if you are getting eczema? If your skin itches and turns red from time to time, you might have eczema. Symptoms of eczema is vary depending on the type of eczema. Symptoms of eczema may include small bumps or rashes that may leak or ooze fluid, red patches and swollen skin from scratching, discolored patches of skin that is typically red or brownish gray, mild to severe itching that may worsen at night, dry, flaky, cracking or scaling skin that can appear thickened, and skin that has crusted over from scratching. Let me explain to you some of the factors and causes that may lead to eczema. Eczema can be caused by several factors, including allergenic foods, environmental triggers, and also genetics. First and foremost, allergenic food. According to the US Food and Drug Administration, there are 8 majors of food allergen, includes milk, tree nuts, eggs, peanuts, shellfish, soybeans, wheat, and fish. The term allergen is referring to a substance that may cause an allergic reaction. Next, environmental triggers. There's a lot of substance in the environment that can cause irritation towards the skin. Flare-ups can be triggered upon contact with irritants such as soap, detergents, smoke, rough fabrics like wool, and hot weather. Plus, dry air can cause the skin to dry and sweat due to the high heat that can make the itchiness worsen. Genetics are also one of the factors and causes that can trigger eczema. You are more likely to have eczema if there is a history of dermatitis or skin irritation in your family members. Furthermore, eczema also often runs in family members that tend to develop hay fever, asthma, and certain food allergies. Besides, let me tell you, how does a dermatologist diagnose eczema? A doctor or dermatologist will examine your skin condition, review your medical history, and look for classic and common signs and symptoms of eczema, which are redness and itchiness. Usually, the doctor is able to diagnose eczema based on the examination of the skin conditions. There is no lab test needed to identify eczema. The doctor may also use patch testing or other tests to rule out other skin diseases or identify conditions that accompany your eczema. In addition, an allergy test also needed in order to determine the possible triggers or causes of eczema. After being diagnosed with eczema, indeed, you will wonder how eczema can be treated. For the time being, there's no cure for atopic eczema. The treatment provided is focusing on healing the affected skin, relieving symptoms, reducing the frequency of flare-ups, and preventing skin infection. For today's video, we will focus on the medications that help in reducing inflammation and rebuild the skin. Medication that is focusing on reducing the inflammation is cortisone cream, while an emollient is used to rebuild the skin. Next, these are the principles of using dermocorticosteroids in order to reduce inflammation. Dermocorticosteroids are crucial for calming inflammation and reducing red and oozing lesions. It is needed to be applied once a day until the inflamed lesions disappear entirely, and we need to reapply the medication again once the redness appears. We need to apply the dermocorticosteroids only onto the affected areas, and it is required to be applied slightly outside of the area once the lesions appear. These are some of the examples of dermocorticosteroids medications. Hydrocortisone cream, clobetasol ointment, betamethasone cream, and mometasone cream. These are the topical steroids ladder. I will list out from the least potent to the most potent steroids. It is started from hydrocortisone, clobetasol, followed by betamethasone, mometasone, and the most potent one is clobetasol. For the least potent steroids like hydrocortisone and clobetasol, they are suitable to be applied onto the delicate area including face, anterior neck, inner thigh, and groin. Meanwhile, for the moderate potent steroids like betamethasone, you are advised to apply only on the body area and try to avoid from the eyelids. For the potent and the most potent steroids like mometasone and clobetasol respectively, you can only apply them on the hands and feet area, and please avoid from applying on your face or other delicate areas including armpits, eyelids, or genital. How can flare-up be prevented? Firstly, we need to moisturize our skin often. Secondly, try not to sweat or get too hot. Thirdly, avoid sudden changes in temperature or humidity. After that, try to manage our stress in a wise way, such as by exercising. Then, try to avoid scratchy materials such as wool. We also need to avoid from using any harsh soap and detergent. And finally, we also need to avoid food that can trigger the symptoms. Next, I will discuss the uses of emollients in eczema. Emollient will help to restore the skin barrier, thus reducing the skin dryness and thereby reducing the sensations of itching and tightness. We should apply emollients during flare-ups and a lull. These are the types of emollient that can be used for the treatment of eczema: cold cream, balm, lotion, ointment or thick cream, and emulsion. Lastly, I will elaborate on some of the advice that is needed to be followed when there is an occurrence of eczema. Firstly, try to avoid from scratching or rubbing the skin. This can make the itch from atopic dermatitis worse. You need to apply moisturizer whenever the skin feels dry or itchy. Secondly, you are encouraged to wash all of your new clothes before wearing them. This will remove formaldehyde and other potentially irritating chemicals which are used during production and packing. Add a second rinse cycle in order to ensure the removal of soap if you are concerned. Residual laundry detergent, particularly that contain perfume or dye, maybe will irritate your eczema when it remains in the clothing. Changing to a liquid or milder detergent may also be helpful. You also need to wear garments that allow air to pass freely to your skin. Open weave, loose-fitting, cotton blend clothing may be the most comfortable to those with atopic dermatitis. You need to avoid from wearing wool. Next, try to work and sleep in a comfortable surroundings with a relatively constant temperature and humidity level. After that, you also need to keep your fingernails very sharp and smooth in order to help preventing damage due to scratching. And lastly, try to avoid things that make itching and rash worse.